Thank you for your interest in being a project delegate with the 9 Neighborhood Fund, which is our participatory budgeting process. In this presentation, we will be going over what we're doing with the 9 Neighborhood Fund and participatory budgeting, as well as the roles of the project delegate. So if you've come across us, maybe at one of our idea collection events or online, you've seen the question, how would you invest $1 million to make your communities more healthy? And today we're going to be kind of breaking down what that means and how you can be doing that through this process, participatory budgeting. So participatory budgeting is a democratic way of deciding how a pool of money should be spent. And participatory budgeting looks different everywhere. Sometimes you'll see it being done on a city level. Sometimes you'll see it being done by nonprofits. Sometimes you'll be seeing it done in a school. And really what it is instead of the government or an organization determining programs, this is a way for community members to decide what they want money to go towards and what projects they want to see in the community. So in this presentation, we'll be going over the participatory budgeting and the role of the project delegate. We'll go over some tools that you'll be using for project development, and then after you review this recording, you'll be picking your committee preferences. The 9 Neighborhood Fund is the name of our participatory budgeting process, and this name was decided by our steering committee to acknowledge the 9 different neighborhoods that make up 02908 and 02909 zip codes. And so this is a collaboration between the Central Providence Health Equity Zone, the Executive Office of Health and Human Services, the Department of Health, and you. So through this presentation and this whole project, you'll be hearing a lot about the health equity zones. But what is a health equity zone? And so these are place-based initiatives across the state that acknowledge that the social determinants that make up your health, so your access to schools, quality food, all of these things have more to do with your health than going to a doctor's or even your genetics. And so health equity zones were an initiative started by the Department of Health to put investments into those kinds of social determinants. And these are initiatives across the state, and ours is in Central Providence, which is the 2 zip codes of 02908 and 02909. One Neighborhood Builders is the backbone of the Central Providence Health Equity Zone. Many might know One Neighborhood Builders for our affordable housing development, but we also provide programs in the community in addition to this. So as we were talking about with health equity zones, we're trying to address the social determinants of health. And so here you'll see a chart that outlines what those entail, including education, economic stability, social and community context, neighborhood and built environment, and healthcare access and quality. So as you can see, how our communities are healthy have much more to do with education and other things, and not just healthcare access. How does participatory budgeting work? As you'll see in this loop, there's many different stages to a participatory budgeting process. And our process started back in the summer. So we put together a steering committee who designed the rule book for this process, answering questions like who can vote, what are the project maximums, what are the project minimums, who can be a project delegate. All of this was determined by our steering committee over the summer. They also helped us put together a community engagement plan for developing ideas. Then, once our rulebook was finalized, we went into idea collection mode. And so that might be how you learned about the project. So we used a lot of different methods, including hosting our own town halls, going to events like the Atlantic Flea Market, using online. And in that process, we collected a little over 300 ideas. The step we're in now is developing the proposals. So taking those ideas that were collected and putting together, costs for those, how would that be implemented, answering all of these questions by the project delegates. Then we vote. Anybody that is a resident of 02908 or 02909 or goes to school in 02908 or 02909 that's older than 13 will be able to vote on projects. And then based on those votes, the winning projects will be funded and implementation will begin around July of 2023. And so in the proposal development phase, the timeline starts with proposal development, so researching community needs, looking at all the ideas that were collected, figuring out which ones are feasible, figuring out which ones will be able to be implemented within our budget, getting feedback from experts, and writing the proposals. Once the proposals are developed, there'll be some vetting that happens. The part of this funding for participatory budgeting is coming from Medicaid. And so that might mean that the projects, the way that they're worded, have to be a specific way in order to get that Medicaid funding. And so there'll be vetting by EOHHS of proposals to make sure that they can be implemented with Medicaid dollars. Once the proposals are vetted and completed, there'll be a project fair so that people know what they're voting for, going out into the community and giving an opportunity for people to ask questions about what's on the budget, what does that look like? And, it's almost like a science fair. And then people will vote. So next, we'll be talking about the role that you will be playing as a project delegate. This is a video that you can watch on your own time about the role of the project delegate and goes into a little more detail. So there's a QR code that you can scan, or the link to this will be in your email. What makes a project eligible through participatory budgeting? So there are a few different factors that went into this. As we had said earlier, a steering committee put together the rules of this process, and so some of these eligibilities come from that, and then some of these eligibilities come from Medicaid, who is funding the project. So the first one that I want to focus on is that the project needs to address the social determinants of health. And so as we saw in that chart earlier, that can include a lot of things. But what it really focuses on is that it needs to benefit the community as a whole. So projects can't just fund one business in particular, or just one resident, right? It needs to be at benefit to the entire community. Of course, it needs to impact residents of 02908 or 02909 because this is the 9 Neighborhood Fund, so it should benefit the 9 neighborhoods. Projects cannot duplicate federal or state benefits or services. And one of the reasons for this is that we don't want to give the city or the state an excuse to not do a project that they already have the budget for. I will say that projects can supplement state benefits or services. So for example, if there's a project that is providing stipends to support food, right, that could be taken as duplicative of SNAP. But if there was a program that helps connect people to SNAP services, that would then be eligible. And because this is Medicaid dollars, projects cannot be exclusive of people who utilize Medicaid. And all that means is that, if there was a project that was just for people who are uninsured, it wouldn't be eligible because it would not be accessible to folks with Medicaid. And then funds can also not be used for things like lobbying. And if you go to the last page of your project delegate guide, there's a full list of disallowable funds. We've collected over 300 ideas. And that might feel very overwhelming as a project delegate because that's a lot to go through. And how do you, as a project delegate, make the determination of what will become a project and what won't? And so this is really the criteria we'll be using for assessing ideas. There are 3 different factors that go into priority projects. Feasibility. Is this a project that can be done within the budget we have? So there might be a need for a project, but if it costs $20 million, right, it may not be feasible for this project. Impact on health outcomes. Again, this is a project through the health equity zones, and so we want to make sure that there is a positive impact on health outcomes through the projects that are going to be on the PB ballot. And then finally, equity. Is this project addressing a need in the community? And all 3 of those will kind of come together to determine what are the priority projects. And in your project delegate guide, there is an example of the type of metrics that you would be using to make that decision. And that's on page 17. These are just a few examples of some of the projects that have been funded or could be funded by a participatory budgeting process. And as you'll see, there's kind of 2 different categories. So there might be programs and services that come from this. After school programming, a community art project, and then there might be physical projects like a tree planting or a bus shelter or a community garden. As we mentioned during the timeline, the final step is implementing the projects that have been voted on. And so based on what the project is, implementation might look a little different. So if it's a program and a service, it might require a request for proposals, which just means that organizations in the community will have to apply for that funding. So if it's an after-school program that gets funded, One Neighborhood Builders, as the backbone, would put out a bid for organizations that might be interested in providing that program or service. The other option is that it might need to be implemented by a city service or agency. So I'll give you an example. If there is a project that is going to be happening at Riverside Park, because it's happening in the park, if it's new playground equipment, the only entity that can do that is the Parks Department. So there wouldn't be a request for proposals because it would need to be done by the city themselves. What will you create as a project delegate? First, you'll be creating the project proposals. Then you'll be creating posters for the fair that we had talked about earlier. So this is creating materials that make it easy for people to understand what your project is trying to do in the community. And then finally, you'll be creating ballots that will be what people use to vote come the spring. What have we covered so far? Well, we went over health equity and what that means. We went over the PB process goals and timeline, and we started to talk about the role of the project delegate itself. And before we go on, a few reminders, because I know it can feel very daunting, but there is a lot of support that you will be offered as a project delegate from Health Equity Zone staff, from the state, from each other, and from your facilitators. And there's lots of resources in your project delegate guide that you can review. As a project delegate, you'll be a part of one of 6 groups. These groups are themed based on the ideas we received during idea collection. The first is community connectedness, and so these are projects that have to do with bringing people together in the community and promoting civic engagement. So this could be a community arts project, this could be a community event, this could be a neighborhood meeting. All of these things are about bringing people together. Then you have community health. And so these are the types of projects that would support long-term health and wellness. So think about programs that get people outside and active, healthcare access, supporting our food systems. Next, we have crisis diversion. So these are the types of projects that address immediate short-term needs. Think about eviction prevention services, support for folks that are currently or about to face homelessness, emergency food services. Then you have environment. These are the projects that improve the natural environment of Central Providence and respond to the changing weather needs. So that would include things like litter cleanups, tree plantings, beautification projects, but that would also include snow shoveling, flood preparedness. Then we have learning and development. And this committee would really focus on a lot of different projects, but all of these projects support learning and development at any age. So this could be after-school programs for young people, or even just a space for young people to go after school. And adult learning, so ESL classes or job training programs for older people. And finally, we have public spaces and places. And this is about improving the spaces that we all utilize, making our streets safer, adding lighting to our streets, or adding amenities to bus stops. So what you'll need to do now is think about all of these 6 committees and rank them as to which one would be, one being the committee you'd want to be on the most. It says rank 1 to 3, but you might want to rank 1 to 6 to make sure that if we can't get you in your top 3, we at least won't get you in your 6th choice. And when you're thinking about what committee you want to be a part of, you don't have to have any prior experience, like work experience within that committee, just an interest in wanting to learn more about it. And you'll have we'll be sending a Google form that you'll use to select your committee. So you made it. You listened to this whole entire presentation, listened to me ramble a little bit. So what's next? Well, what I would recommend is to make sure that you watch the video that was in the slideshow and take a look through your Project Delegate guide. I know it's 30 pages, so maybe you can't read all of it, but definitely skim through it, because what wasn't addressed in this presentation is in the Project Delegate guide. You're going to want to make sure that you fill out that Google form to rank your committee preference. At the next meeting you'll be at, you'll be able to complete your pre-survey and your necessary paperwork. So just be ready to do that. If you are under 18, we will need some parent sign-offs on things like your photo release, so just be ready for that. And the meetings will be happening every Thursday for the next 10 to 12 weeks. We won't meet on the Thursdays of April or February vacation. And if there is any support that you need to get to those meetings, please let us know. Childcare will be provided at the meetings, and food will be provided as well when we're meeting in person.